My name is Lisa Adams. I'm one of the physios working in paediatrics in the Children's Hospital in Cardiff. I'm a band 6.
My name is Monica Redding. I'm also one of the physios working in the Children's Hospital in Cardiff, and I'm a band 5.
So the challenge came for us with COVID, really, because we used to have face-to-face groups that we would do with the children, particularly based on lower limb rehab. Once COVID hit and we weren't allowed to have face-to-face patients, and we obviously weren't allowed to have groups of people in a room together, we felt that it was a resource that was really missing from our repertoire of being able to treat people. So we were trying to sort of tackle a way of doing that, and we thought that a way of doing it would be to get everybody together online, which is the modern way now. So we weren't sure how to set that up or how to go about it and sort of the best way to run it and things. So we sought out some training from you guys to try and work out how we could do that the best and most efficient way.
So the patients we were targeting our video group clinic at were children with pain in their legs that they were struggling to manage. So our recruitment process worked in that we did individual assessments for all of our patients and then identified between us those that would be appropriate to join our video group clinic. We mentioned it to parents and the children in their individual assessments, gained consent for them be part of the process, and then sent out invitation letters in the post explaining the process and giving a bit of information on what the clinics would involve virtually. So we ran the clinics. So we explained beforehand that the children would need their parents present for the whole clinic, a parent or carer. And when we did our sort of introduction process, we made sure we involved the parent and the child. And then throughout the clinic, it was aimed at targeting both the parent and a child, really. So it was a joint process for not only the children but their parents or carers.
So we didn't exactly stick to the video group clinic format for all of our sessions. So our first session and our final session were very much set up like the video group clinic training teaches us. And our sessions in the middle were exercise based, because obviously with physiotherapy, that's our main focus for their treatment. But their first session and their final session was around discussion regarding that. So we had a discussion board which was focused on sleep, exercise, pain and nutrition. And we discussed those 4 topics with the children, with the facilitator trying to gain questions and trying to gain conversation from the children, which the clinician then comes into the call and sort of addresses any issues and answers any questions and gives some information. So it's led by the patients basically. And then our sessions in between were much more exercise focused, and we were basically doing their treatment but virtually. And then when in the last session, as like a bit of a roundup, we revisited our discussion board and talked about sleep, exercise, pain and nutrition again. And again, it was led by the children and the questions that they had and discussing what they'd learned and how they'd sort of proceeded towards their goals and what their plan was from then going forward once they were leaving the group. The children really enjoyed the sessions. They fed that back themselves. Their parents also fed back. A quote from one of them is that the sessions have really helped my son over the last few months and it's made such a difference. They both made massive strides towards achieving their goals, which were set in the first session, and they were both very proud of that.
Yes, so the video group clinics have definitely helped us to deliver a more efficient service. So I think one of the things we noticed was that in some of our assessments, we were identifying that we were given similar treatment to similar patients based on what they needed, and it was more efficient to deliver that in a group setting. So by doing the video group clinic, it meant we could still deliver that patient-centered care where they had their own goals and they were able to identify what they specifically needed to do to achieve their goal, and we were able to support them to do that, but delivered it with multiple patients at the same time. So it just meant that instead of seeing them each individually for, let's say, 4 or 5 sessions to be able to establish a goal, work towards it, build strength and review, we could do that all with 4 or 5 children at the same time. So it's definitely improved our efficiency, and I think they've enjoyed it too, because they get that camaraderie between each other and enjoy seeing other children doing the same thing that they're doing, and we can make it a bit more interesting for them, especially when they're with the ages that they are by incorporating games and things. So it's worked really well in terms of improving our efficiency, and I think the amount of patients we're able to see in a period of time has improved, but hasn't compromised at all on patient care, and they're still getting high quality care that's really patient centered. So yeah, it's worked really well for us. It definitely was a challenge keeping them engaged and making sure it was interesting for them. I think we took a bit of a flexible approach to making sure we had games planned into our video group clinic after a period of discussion to bring them all back into focus, and we were worried that the video group clinics could be a little bit word heavy, so we introduced games at all regular intervals that they knew were coming up, so they had a short period that they focused for and were really engaged in that discussion, followed by a game, let off some steam, and then they were ready to come back then and be back involved in that discussion. So I think it was an added challenge in the technical facilitator perspective, but it worked fine with the children, just having that extra bit of fun wedged in.
The children took a lot from it, so it's sort of standardizing the way that we're treating these types of patients as well, because like we say, they're all very similar, and that's how they've been identified for the video group clinic that we set up. And it just means that they're being delivered the same information and the same amount of care across the board, so there's no sort of discrepancy in that either. But yeah, I think they learned a lot, and you could tell that from the end session when it was a bit more reflective and it was a bit more discussing what they'd learned and what they'd taken away from it. And like I say, they were working really well towards their goals, and they were quite motivated for that. And we did a lot in the beginning about sort of goal setting, so once they've achieved this goal, they're ready to set their next goal independently. And I think you could really see by their engagement how much they were learning from it.
My top tip is the more preparation you can do beforehand, the smoother it will go. So we did our practice run and learned a lot from doing a practice run, and we pitched that to sort of members of our team, and were able to get a lot of feedback from that. And obviously having the intensive support was really helpful in gaining some sort of feedback on how the session flows. But yeah, making sure it's really well planned beforehand, and seek as much feedback as you can get would be my sort of main tip. Oh, and also you'd be surprised how much people will answer your questions and engage in discussions. I think we were worried we'd do the discussion board and it would just fall into complete silence, but everyone was actually really up for it. So yeah, I was surprised at how into it the patients got, and how much discussion we got from them.
Yeah, especially with children. I was really worried that they would just sort of sit there waiting for you to give them something, whereas they didn't. They actually very much brought their own ideas, brought their own questions, so it actually worked really well. I think my top tip would be invite, because there are people that just drop out right at the beginning. We had people that didn't attend the very first session, so we actually ended up with smaller numbers than we expected. And I think we definitely could have coped with bigger numbers in the group, but we were just foolishly expecting everyone to attend straight away. But I think also being quite firm in that, if they're late, like we set out the rules really early in the very first session, and they need to stitch those rules, and if they're late and if they miss sessions and things like that, they can't come back into it, because it is a group process and it does need to happen sort of in the order that it's happening in. You can't just dip in and out of it. In our case, it could be different in other settings, but we felt that we had to have those rules made very clear and we had to stick to them.